Good afternoon. My name is Mackenzie Gray, and welcome to ISM's final presentation night. We have a very special guest tonight. Her name is Holly Glover. Holly was my mentor this year for ISM, so I just want to thank her for coming out tonight. Throughout this presentation, I will be talking about the research I've conducted with ISM, as well as my journey, so just sit back and enjoy. I'm going to start off talking a little bit about myself. I'm 17 years old and I'm currently a senior here at Frisco High School. I am the youngest sibling. I have an older brother. I'm the senior class treasurer. I'm involved in NHS and USITT. This is my first year of being in ISM and I'm a huge Cowboys fan. To remember who you are, you need to forget who they told you to be. This not only gets me through ISM, but it really helped me throughout my life as well. Coming into ISM, I had the mindset of having a mentor who is a physician, because my uncle is a physician and my mom's in the medical field. So ever since I was little, she told me that I needed to become a physician in order to be financially stable and to live my life with complete satisfaction. But after interviewing 4 physician assistants and 1 physician, I rerouted my life and I want to become a physician assistant. So this quote really helped me getting along my path of ISM, just starting off. I took ISM because I didn't really know what profession I wanted to be in the medical field. There's so many different types of occupations in the medical field, and they're all so interesting. And I was really in particular about which one I wanted to join. When I was little, my parents told me to consider dermatology because I always had great skin and I took great care of my skin. And so I didn't really know what dermatology was besides the Proactive commercials. So I was like, this would be the great time to, see what the field was like. And I always wondered what it would be like to see physicians' day-to-day schedule. Going into doctor's office when I was little, I just loved how structured the doctor's office were. You have different people conducting different things. And I'm the type of person that likes to have a plan. I'm very organized. So I just love that particular field. And of course, lastly, I just wanted to make sure I wanted to be in the medical field. It's very hard getting into the medical field and it's very hard to stay in the medical field. So I just wanted to make sure that I wanted to major in a science as my pre-med to make sure that that's the field that I wanted to be in without making the choice or without going through different measures to not actually wanting to do dermatology. Every student in ISM has to create a mission statement to just help their journey through ISM or just to get to their goals. So my mission is to seek a profession in dermatology. As a professional in this field, I plan to dedicate myself to my fullest potential and use my positive attitude and researching skills to help me achieve my dream. My objective is to specialize in the diagnosis of skin disorders. I plan to help individuals find treatments that are beneficial to their skin so they are more comfortable with their appearance. One of the most eye-opening experiences with ISM was my UNT field trip. Originally, I signed up for a microbiology class in a lab, but we were actually late to UNT, so I missed my lab. And when we walked into the microbiology class, they were taking an exam, so the assistant teacher was like, oh, well, you can't just sit in here and watch students take a lab. That wouldn't be beneficial to why you're here. And so I ended up sitting in an accounting class, and I learned one thing from that class, that I am not majoring in accounting or anything that has to do with marketing or money, because I honestly did not know one thing that the professor was lecturing about. But I was able to gain college life and experiences and view different classroom sizes. I'm enrolled in Collin County Community College, but it's completely different from a larger university. You just get that 4-year university feeling, and it was a great experience and just a little sneak peek to what I'm doing next year at Oklahoma University. So during this section, I'm going to talk about the research that I've conducted through ISM. ISM is a lot of research. We had research assessments due every week. We have weekly blogs due every week. It's just a lot of research. We had to conduct 5 informational interviews and do our research assessments for that as well. So I'm going to talk about one of the most engaging assessments that I wrote about. This article was from Medical News Today, and the title was, "What is better to get that glow on your skin?" Many individuals, especially teenagers and young adults, spend hours tanning in the sun or fake tan in order to get that sun-kissed skin. but studies show that one can get a more healthier appearance to their skin by consuming fruits and vegetables. That's because fruits and vegetables have carotenoids in them, and that is a nutrient that's very beneficial to your skin. It allows you to get that orangish tint to your skin. And I actually wanted to conduct my original work over this article to prove it right or wrong, but I was unable to find a mentor in time, as well as to gather information to conduct an experiment. But I love this article because it's an alternative to tanning beds. I oppose tanning beds because you are at higher risk of getting skin cancer, and people don't believe that they can get skin cancer just because they're young or just because they do it periodically, but that's completely inaccurate. If you're in tanning beds, you're at higher risk of getting skin cancer. It doesn't matter how long you do it or how much you do it. But also what I learned is that people who have blue eyes and fair skin and blonde hair are most prone to getting skin cancer. I also researched the difference between a physician and a physician assistant because I was not really confused, but I was hesitant as of which I wanted a physician as a mentor or a physician assistant. But I found out that becoming a PA, you have more flexible hours, you have quality patient time, it's less schooling, and you don't have that much responsibility on your plate. Being a physician, you have to manage a facility, you have your co-workers that you have to make sure that they're on their game and that they're doing everything right. And just the person that I am, I get stressed out really easily, so I don't think that I would be able to handle all of that. So I just like researching this particular field because I thought I could have a connection with it, and I just thought that that explains me more. So the first part of ISM, during the beginning of the year, we had to conduct 5 informational interviews, and so this section is going to go through the people that I interviewed. My first interview was with Dr. Karen Lunn. She's a physician at Plano Dermatology. This interview was very informative, and what I liked most about this interview is that she stated, I am the type of person that would rather know a lot about a little bit than a lot about a lot, and I really connected her with this quote because I'm the same way. I would rather know a lot about one particular thing so I can become an expert faster, and I just feel like the skin is the best thing to study because, of course, it's your largest organ, but once you start learning different skin conditions and different things about the skin, it becomes very repetitive. So you can, of course, become an expert faster. My second interview was with Lainey Buck. She was the first physician assistant I interviewed. She works at Rogers Dermatology. She said that she loves being active, and this is the perfect job because, of course, you work the same hours throughout the week. And I don't know if she was joking about this or not, but she said that being a PA is better because she knows dermatologists that want to become PAs because they were experiencing lawsuits. And I was like, okay, well, definitely don't want to experience lawsuits in my future, so I think this would be the right occupation for me. I'm going to skip over my third interview and go to my fourth. His name was Matt Bruno. He's a physician assistant at Dermatology and Skin Cancer Surgery Center. He identifies himself as a problem solver, and he told me this story how he periodically saw this patient, and she was about our age. She was 16 years old, and she had a severe case of acne, and she would see him, and the last time he saw her, she grew out her hair. She was always just hiding behind her skin. She wouldn't talk to him much because she was so insecure about how she looked like. And so he said that he not only wants to have her have that acne treated, but he also wants to gain her self-confidence. So I really love that about Matt. My fifth interview was with Leah Schiller. She's a physician assistant at Dermatology Consultants of Frisco. She is very content with her choice of occupation, and I asked her how she tends to stay emotionally stable when dealing with patients with chronic skin disorders, and she says that she kind of builds a wall knowing that she cannot cure everything, but she tries her best to, and that wall helps her to not become emotionally attached to the patient. So my third interviewee was with my current mentor. Her name is Holly Glover. She's also a physician assistant at Dermatology Consultants of Frisco. What I loved about her in our interview is that she was so engaged in the interview. She not only answered my questions in full depth, but she also asked me questions, which I loved. She was so friendly and understanding that I was nervous about the interview, and she just told me to relax and chill and that she's not here to pressure me or anything, so that was awesome. And she's so inspirational. She made me have a stronger backbone. She made me be more social. She kind of got me out of my comfort zone, and she was just awesome. She told me that I need to do what I feel is best for me and not worry about my mom or my family. She's like, this is your life. Like, you cannot put your family with this, even though they're a big part of your life, but you just need to do what you want to do because it's your life. And my mentor visits are always educational and fun. I always see a different skin condition every single time I go into my mentor visits, and we're never sitting down more than 5 minutes. We're always up on our feet, moving, and it's just great. So this is my mentor selection. I'm just going to cover some of the highlights that I've had with Holly. So I met with her Mondays and Thursdays, alternating throughout the weeks from 10:45 to 12 p.m. My mentor visits were always structured, but I saw different patients, so I would always go into the office knowing where exactly to go, and I knew what we were going to be doing, which was great. I favored seeing patients with warts or psoriasis because I had warts when I was a freshman, and it's just so aggravating, and so I was able to connect with the patient and just tell them my stories and just kind of help them get through the process. And also psoriasis, because that was my whole research throughout this ISM journey. So not only did I get to research psoriasis, but I actually got to see it and I got to touch it if the patient allowed me to. I was never denied access into a patient's room, which was amazing. The facility was just great. The nurses really helped the patient and myself because they were just like, oh, she's a student here observing, like she's not going to cause any problems. So they just really helped me throughout this journey as well. I observed 2 biopsies and 2 surgeries, and it was the best experience of my life. I just did not know the process of doing surgeries, and it was just great. And I also learned that you need to eat a meal before you see surgeries because you can get very, very dizzy. And so that's a key part of surgeries. Some more of my highlights were, like I said previously, mentor visits were always busy. We were never sitting down. We were always seeing patients. I was amazed at how awesome my mentor was at her job. I just loved seeing her connect with the patient and just communicate with the patient. And if she never saw the patient before, she would just observe their skin condition, maybe ask to feel it, and she would just identify the skin condition on the spot. And I would always think to myself, like, wow, I really wish I'm an expert like Holly when I get older, because it was just amazing seeing her at her work. I love seeing surgical procedures, and I noticed how patient profiles were crucial in dermatology. Before we went to go see a patient, we would look at their patient profile history just to get connected with that patient. After we saw the patient, we would update their patient profile, and also when we were there with the patient, a nurse would update their profile as Holly was talking to the patient. So patient profiles were critical in the dermatology field. This picture just shows one of the procedures that I was able to see. This is a punch biopsy. That little circle that you see on the skin is called a lesion, and that tool that it's holding is the person's holding is a punch biopsy tool. So basically what you do for a punch biopsy is you want to take that tool and go through the skin, but before, of course, you go through the skin, the physician marks off the area in a circle with like a pin, and then they would inject the skin with a numbing solution so the patient wouldn't be able to feel that pressure. So the tool goes through the skin to the tissue, but the physician or the physician assistant has to be very critical when performing this procedure because they don't want to crush the tissue. And so you just twist the pin in a circular motion so the skin sample kind of looks like a little cylinder shape. And then we just stick that in a little container and we send it off to the labs and they identify it. So you normally do this with but not non-benign moles just to see if it's benign or not, or just to see if it's skin cancer. So that's the procedure for a punch biopsy. For my original work, I was really I didn't really know what to do for my original work because I was so stuck on the experiment. But after meeting with Holly for our first mentor visit, I asked her, I was like, hey Holly, like I'm really hesitant on what to do for my original work. Can you help me? And the first thing she said was psoriasis. And I was like, well, I really don't know what psoriasis is, so I guess that could be a good factor. and she was like, it's the best skin condition, you need to do psoriasis. It's so interesting. So I kind of put psoriasis with a patient profile because I knew how critical it was in the dermatology field. So I was like, well, why don't we just create a patient profile that with a patient that has psoriasis? So that's kind of how I came up with my original work. So psoriasis is a skin disease marked by red, itchy, scaly patches. People who get psoriasis tend to have a blood relative who had psoriasis, and there are multiple types of psoriasis, but the main two are plaque and scalp. So plaque psoriasis causes patches of raised reddish skin covered by silvery scales on the elbows, knees, and lower back, but it can occur anywhere on the body. So the picture on the left is psoriasis on the elbows, and then the picture on the right is psoriasis on the knees, and you can really tell the silvery patches on the knees. It's very itchy and it's just aggravating because it never goes away. It's a chronic skin condition, so it can always come back and it's not curable. Scalp psoriasis is identical to plaque psoriasis, but of course it's on the scalp and it tends to be very itchy. It can be misdiagnosed as dandruff because as the patient itches your scalp, of course those flakes are coming off. So patients normally normally think that it's dandruff, but it's not. Patient profile charting. The terms medical record, health record, and medical chart are used to describe the systematic documentation of a single patient's medical history and care across time within one particular healthcare provider's jurisdiction. So basically what this is saying is that each patient has a profile about them. It has your past medical histories, your current medical histories. It just has everything about yourself on there so that the facility knows who you are and what you have before they look at you. So this was my patient profile I created over my original work. And each patient profile follows SOAP note. It's an acronym of subjective, objective, assessment, and plan. So this was just my patient background. Her name is Brinley Hill. She's a 31-year-old female. And on my original work, it just states her date of birth, her account number, where she lives, her insurance, and of course the facility she's visiting. The subjective selection is the history of the patient. It includes the HPI, also known as the history of present illness, the narrative of the complaint, past medical history, current medications, and a review of systems. So Brinley came to the facility because she had a rash. The HPI states that she's a 31-year-old female with rash on elbows, knees, and scalp. Rash has been present for about 4 weeks. It is red, scaly, and itchy. Patient has tried hydrocortisone ointment with no relief, and patient is here seeking evaluation. She's not on any current medication. She has no past medical history. She does not have any surgical history. She doesn't have any family history documented. She does not smoke, and she uses sunscreen regularly. And this is important because we're just seeking to see if she has skin cancer, melanoma. That's a very important factor, is if you use sunscreen regularly. She doesn't have any allergies. She denies past hospitalization, and she has no joint pain or other dermatology issues. People with psoriasis normally get joint pain, so the fact that she does not have joint pain is great, but you can still have psoriasis without joint pain. The objective selection is the physical exam and data selection. So on her elbows and knees, she has patches of raised reddish skin covered by the silvery scale, and on her scalp, it's identical to the elbows and knees. She has silvery white scales and red patches. The assessment selection is the assessment of the patient's problem. The first sentence is a description of the patient's problem, and then the second sentence, you're going to identify the skin condition. So the first sentence, I put the rash is unspecified, and 2, I classified it as psoriasis. The plan is for the patient based on the problems identified. So for her treatment, it states patient with plaque psoriasis, BSA 1%. The patient was counseled extensively about the pathophysiology, chronic nature, and management of psoriasis. We discussed the psoriasis treatment ladder. We often start off with a topical medication. That's just a medication that's applied directly to the skin. Then progress, if needed or possible, to phototherapy, and lastly consider systemic agents, oral versus injectable. The patient was prescribed topical steroids to the affected areas, and the medicine that I prescribed to her was clobetasol ointment 0.05%, and she's going to apply this to the elbows and knees twice daily, and then clobetasol shampoo 0.05%, and she's going to wash her hair with this daily and leaving her scalp 5 to 10 minutes before rinsing, and I'm going to see her for a follow-up in 2 weeks. So for the product, I wanted to further my studies with psoriasis, but I did not really know what to do because psoriasis did not have a cure. So I asked my mentor what to do for my product, and she said, write a literature review over psoriasis and the treatments. I was like, okay, well, what's a literature review? Never written one. I don't know what to do. And so she was like, okay, well, you need to look up how to write a literature review and conduct a 15-page paper over it. So I'm halfway there. I'm on my 9th page. So throughout this selection, I'm just going to talk about the different treatments that are in my paper rather than just read my paper to you guys. So the steps to create my product, I had to first find out how to write a literature review. I had to research all the treatments for psoriasis, and lastly, conduct my paper. There's 4 different types of treatments for psoriasis. You have topical treatment, light therapy treatments, oral medications, and natural treatments. Topical treatments, like I said previously, it's just applied right to the skin. You have salicylic acid. It smooths the skin by promoting the shedding of scales. However, using acid over large areas of the skin may cause the body to absorb too much medication. Salicylic acid may cause irritation to the skin, which can lead to hair lossage or hair breakage and temporary hair loss. This medication comes in a lotion, gel, cream, and shampoo. And this picture just shows you psoriasis before and after the topical treatment. It looks better, but of course it's always going to come back. Steroid-based creams decrease inflammation, relieve itching, and block the producing cells that are overproduced in psoriasis. You have to be very cautious when using these creams because of course they do have steroids in them. So putting too much steroid-based cream on your skin can lead to severe side effects. Calcipotrin is related to vitamin D and has been proven to be effective for treating psoriasis, especially combined with the topical steroid cream. So you would just apply this cream to another topical cream and rub it on the affected areas. Coal tar ointment and shampoos. These products can help slow the rapid growth of skin cells and alleviate the symptoms, but people are more vulnerable to the side effects. This type of treatment can cause folliculitis, and that's just the inflammation of your hair follicles. This is caused by a bacteria, so you just have to take precautions when using this treatment. Then you have your light therapies. Normally, individuals who get light therapies have more severe psoriasis that's all over the body, not just in one particular area. So you have the PUVA. It is the drug Psoralen combined with ultraviolet light A. This form of therapy is less used today because it has shown to increase the chances of skin cancer. This is a PUVA chamber. I've never seen one, but it looks kind of cool, so I put that on there. And you have your UVB. It's an effective treatment for psoriasis. UVB penetrates the skin and slows the growth of the affected skin cells. This one is more used than the PUVA. Then you have your natural treatments. Individuals with psoriasis don't really use natural treatments because psoriasis is very aggravating and they just want it gone in that instant. But natural treatments are remedies, of course, that can be performed at home, and they take way longer to cure the psoriasis or to treat the psoriasis. So fish oil and Dead Sea salt are 2 remedies that can be treated. Research suggests that consuming fish oil supplements may bring improvement to psoriasis, and that's just your fish oil tablets. And then bath solutions can remove the scales and ease itching. An example of a Dead Sea salt is Epsom salt. So you just want to soak in Epsom salt for about 10 to 15 minutes. Okay, so Stacey London is a host on What Not to Wear, and she was diagnosed with psoriasis at age 4. So she's on this TV show, and she's just going to explain her story about how psoriasis affected her life. Oops. Can you play that?
Please welcome Stacy Lund. It's a larger story of your style, your sense of style, really born out of with psoriasis.
Yeah, I mean, I think my inclination towards all things sparkly and pretty and perfect sort of came out of the fact that I was diagnosed at the age of 4 with psoriasis, and I never felt okay. You know, being that young and being diagnosed with a disease, a chronic lifetime disease, made me feel very different very early on. And even though when I first thought it wasn't very severe, it got very severe. By the time I was 11, I was covered in red scales from my neck down. And I had crazy thick scalp psoriasis. So I had longer hair than I do now. And because we had to put all sorts of things and goo and stuff in it every night, and I would wear a shower cap, my mom would have to scrub it out with boric acid every morning. And so it got to be too difficult, and we had to cut off all my hair. So at 11, you know, being covered in red scales and having a crew cut, you can imagine, you know, it wasn't the easiest time of life, but it definitely made me feel completely insecure. But even after it started to get a little bit better, those feelings of insecurity, I don't think ever really went away. And it's hard enough to be 11 years old. Imagine, you know, having notes in your locker that say you're uglier than the elephant man, or get out of school before you infect us. And
that's a really good point, because I think a lot of people misunderstand psoriasis and other skin conditions. Psoriasis, as you can see on this animation, it is not an infection. It is literally your immune system gone awry. It is an autoimmune disease. You hear us talk about that a lot. But in this case, your immune cells, as you see here, actually attack your skin. And when they attack your skin cells actually rapidly replicate and then die off. And what it does is it creates these very intense, scaly patches that Stacy is so familiar with. You see them oftentimes on your elbows, your knees, your back. But as Stacy mentioned, it can be almost anywhere. And also, it may not look like your classic psoriasis. There are things called psoriasis that look like bug bites. And so if you have bug bites and they never ever go away,
yeah,
it could be psoriasis. Not everything's the classic plaque psoriasis that you're describing.
yeah, I mean, looking at those pictures, I have to say, it's bone chilling for me, because I really am so empathetic to people who suffer from all sorts of autoimmune diseases, because they're so tricky. They present themselves in so many different ways. You don't know whether they're going to get better or worse. A lot of different things, you know, sort of play a part here. The thing about them that's so tricky is not only are there so many different sort of permutations of the diseases themselves, every person is different, and every person is going to have a different kind of reaction. So sometimes you may get better, sometimes you may get worse. Some people get worse and stay that way. Some people get better and stay that way. It's really such an individual disease, which is why I partnered with AbbVie to do this campaign called Uncover Your Confidence. And there were a couple of reasons. The first is really understanding that a lot of people who get this disease are so challenged psychologically and emotionally that it's not life-threatening, but that it is so emotionally disabling, and that a lot of people give up hope. And so one of the things that was most important about this campaign was to kind of empower patients, not only to go out and find the right kind of care. You must find the right dermatologist, because I'm sure, as you guys know, not all dermatologists specialize in psoriasis or even autoimmune diseases. So it's really important to find the right care, but also to empower yourself by not thinking that your skin or your disease defines you.
So well said. Thank you so much more about Uncover Your Confidence by visiting the drpg.com.
So as Stacy said, it's humiliating. It causes a person to feel very insecure, and a lot of people give up hope because they know that even if your psoriasis is gone for 3 months, there's still that option that it can come back. And so the purpose of this product was to make awareness for those affected by psoriasis and individuals who are not. It's very important for that person to go find an individual or a physician that knows how to treat the psoriasis. And for the individuals who are not affected by psoriasis, it's important that you know that psoriasis is not contagious. Many people think that it's contagious because of the way it looks on someone's skin, and you don't want to be around that person because you're scared you're going to get it. That's false. So the purpose of my product was just to create awareness for those that there are things that you can treat your psoriasis with. It may take a long time, but there's still treatment for it. Concluding